Differential diagnosis of vaginitis. So broadly describing, it can be the bacterial vaginitis, it can be the trichomonas, as well as the candida vaginitis. So firstly, we are going to look at the bacterial vaginosis. This is caused by the Gardnerella vaginalis. So firstly, upon examination, it includes the presence of the thin, as well as there is presence of the off-white discharge, and this is present. It is present with the fishy. There is presence of fishy odor. This is in the bacterial vaginosis. Next, there is also no inflammation which is seen. Now moving ahead at lab findings. In case of bacterial vaginosis, the lab, it shows pH. pH is greater than 4.5. There is also presence of the clue cells as well as a positive. This is nothing but the whiff test, and it is seen in the, there is the amine odor. This is along with the KOH. Next, now looking at the treatment of the bacterial vaginosis, it is the presence of the metronidazole. Now we're going to look at the next differential diagnosis, that is the trichomoniasis. It is caused by, as the name suggests, it's caused by the Trichomonas vaginalis, and here also it is typically a thin, and here it is nothing but it's a yellow green as well as a malodorous, whereas bacterial vaginosis was a fishy odor, and this is a frothy discharge. Next, there is also a vaginal inflammation. Now looking at the lab findings. In case of lab findings, the pH is greater than 4.5. There is also the mobile trichomonads. Now looking at how to treat this. Treatment is by the metronidazole as well as the treatment of the sexual partner to be done. Next, we are going to look at the next disease. Next disease includes the Candida vaginitis, and it is caused by the Candida albicans. And here the examination includes there's presence of the thick as well as the cottage cheese discharge, and there is also presence of the vaginal inflammation. Now looking at the lab findings. Lab findings include there's presence of the normal pH. This is between 3.8 to 4.2, as well as there's presence of the pseudo hyphae. And the treatment is by presence of the administrating fluconazole.